So can we talk a little bit about insurance?
Yeah, sure.
Since insurance, I mean, I remember back when dental insurance was quite generous and inexpensive. I mean, I used to sell it back right out of college. I was an insurance agent for 7 years.
Right.
And for $30 a month, you could have a benefit of thousands of dollars a year in coverage, at least $2,000 for a crown. Now it's like $1,000 and you're lucky.
Yep.
And then maybe 2 preventive visits.
Sure.
But now, of course, it costs much more than $35 a month. So as the benefits are becoming less generous or people, close to my age or older than me, let's say on Medicare, and maybe they, maybe they don't have dental coverage at all.
Right.
What options, like what should we be budgeting? As we get older, most of us seem to need more dental care, not less.
Yep.
What's a budget, and then what are some ways to think about maybe insurance? Like I know you offer an insurance plan that we intend to go on in the very near future.
Yeah, I mean, the dental insurance industry is, I guess, relatively new, maybe 30 years. It's not, it's probably 2 generations old.
Yeah. Wow, that's right.
And I think that, like, I'm going to give the analogy of like airline tickets, right? They've also become really competitive now. I mean, airline tickets haven't really changed, even though the inflation's changed a lot.
Yeah.
Airline tickets are about the same price as they were, a couple of generations ago, right?
Right.
I mean, when I was a kid, we were lucky to take like 1 trip a year.
Exactly.
And that was a big deal, right? That was, it was a big expense. So when dental insurance first came out, I think that the maximum benefit per year was $1,000 or $1,500. This is before I was a dentist, so it was generous, yeah. Comparative, like to what the cost of a crown might be, like $300, right?
Wow.
For example, maybe a filling was like less than $100.
Right.
And even though procedures have changed, budgets have changed,
technology
payrolls changed, technology has changed. Like, but the price of, the annual maximum stayed about the same, right? So, and why is that? Well, I mean, it's probably market competition. Dental insurance has become just a marketing plan. Yeah, it's just, that's it. It's a coupon that goes in between you and your dentist.
A coupon, yeah, that's a good way to put it.
It's similar to kind of like, like you could sell a coupon book.
Yes.
Right? For restaurants in the area, or like car wash. Or let's say a restaurant, like a restaurant coupon book. This is somebody's, they've got a magazine that they want to sell, and they got all the different restaurants and coupons for the restaurants. So they're gonna go to the restaurants and say, "Do you want to participate?" And then they're gonna sell the coupon book to the general public, and it's gonna have coupons for different things. And like one restaurant might want to have like free steaks on Thursdays.
Yes, right, yeah.
Right. But unfortunately, like that steak it's only like before 6 o'clock,
Yeah.
And so now it's 6:30. Sorry, but you're at the restaurant, right? You might as well eat.
Yeah.
So but you can't use the coupon, right?
And
so these restaurants feel like they have to buy or participate, give away the free steaks or whatever they are, appetizers or whatever. They feel like they need to do this to get clients, right?
Yes, yeah.
Or maybe they're like a new restaurant. And the customers, they feel like, hey, I'm not going out to eat without a coupon book. Of course not. That would be like, who would want to do that, right? Because it's so expensive to eat out.
Yes, right.
Right.
Yeah.
So the general public in this community feels like they have to have their coupon book that costs $700 a year, but you get $1,500 worth of savings.
If you use all the coupons.
If you use coupons.
Yes, right. Which means you're going out a lot and spending a lot.
Exactly.
Yes.
You're going out a lot, spending a lot. You maybe have unnecessary procedures.
Yes.
You're buying things that you wouldn't ordinarily do just to utilize it.
Correct.
And then also the feeling like, hey, gosh, it's time for a new coupon book. And I don't even really think we used it, did we? Did we use it?
It's
we
still
didn't.
in the drawer.
Yeah, it's still in the drawer. We didn't even use it.
Exactly.
And we paid $700 last year, and we didn't even use it. But that money's gone. Meanwhile, the guy that's running this coupon system,
Making bank.
yeah, exactly,
Yeah.
cha-ching. And that, unfortunately, that happens in America way too much. I mean, I don't know if you've seen the salaries of the CEOs, but insurance CEOs are under scrutiny right now. And in dentistry, if you find a provider that you trust that has reasonable fees, might have like a system to save you, directly.
Yes. Yeah.
So the concept, like defining the term insurance might not be the appropriate term.
Yeah.
Right? But people are just trying to have reasonable fees, kind of like concierge medicine.
Yes.
Right?
Yeah.
Medical doctors that they have enough clients that trust them, so they don't participate in the big, the big health system.
Yes.
Right?
Yes.
So yeah, I mean,
it's almost like prepaying something for something that absolutely you will use. That's essential to your health, like having your teeth looked at and cleaned twice a year.
Right, exactly.